Welcome to YourFirstAid.com's Medical Corner. I'm Erin Wolf. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you with us, Dr. Michaels.
Thank you, Erin. It's nice to be here.
Our first question for you today, what are neuromas?
Well, neuromas are inflammation of nerves in the foot, usually between toes 3 and 4. 4 is next to the pinky toe, and oftentimes you feel pain, tenderness, tingling, burning, shooting from the ball of your foot into your toes. And you can also feel like you're walking on a lump or a pebble, or sometimes it feels like your socks are rolled up on the bottom of your foot in your shoe when actually they're not. So you get all these weird sensations, and that's caused by a pinched nerve as the nerve travels through one of the tight structures in that part of the foot.
All right, and how then do you treat a neuroma?
Well, neuromas are treated in the office quite effectively. Initially, we try a strapping on the foot, which takes the foot and puts it in the proper position to decompress the nerve. We also use a custom orthotic. That is made from a mold of your foot and put into your shoe, which supports your arch, and that decreases the anatomical structures which pinch that nerve and cause the pain. If that doesn't work, we also recommend changing your shoes to a more wide shoe, whereas a high-heeled pointy shoe can cause your toes to be pinched together, which can make the nerve compressed more, which makes your symptoms worse. If that doesn't work, then we progress. As you can see here, it's conservative to invasive procedures, and the surgery is always at the very end. But we progress to steroid shots, in addition to everything else we've tried. And that usually takes care of it, but if not, we will progress to alcohol shots. And alcohol is a great medication, actually, for injecting into a nerve because it takes down the symptoms that you're feeling in a stepwise approach. And you're in control of this, and it's a series of usually 3 to 10 shots. And it's a very slow process, but we don't want to go too fast with that and overshoot the decrease in symptoms and cause numbness. We want you to still feel. We don't want to take that away. And usually that takes care of most of the problems with neuromas. Now, if that does not work, you may need to have a small procedure done. And that requires a stay in a surgery center, and it takes about 10 to 15 minutes to do the procedure. And what we do is we make a small cut on the top of the foot over the nerve and take out that nerve. Afterwards, of course, you can walk right away on it, and it takes about 2 weeks to heal. And that usually takes care of it. The nerve is sent off to the pathologist, and we make sure that it's an okay nerve. And your symptoms usually resolve after about 2 to 3 weeks after the procedure. But before you have to have surgery, usually about 95% of people get better. Of those 5% that have to have the procedure, virtually 99% of those people get better with this procedure.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your specialist questions on foot and ankle conditions only here on YourFirstAid.com. Welcome to YourFirstAid.com's Medical Corner. I'm Erin Wolf. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you with us, Dr. Michaels.
Thank you, Erin.
Our first question for you, what are fungal nails?
Well, fungal nails, another term for that is onychomycosis, but toenail fungus is caused by an infection. And the fungus that causes it is in my shoes and your shoes. It's just that some people get it and some people don't. Now, there are certain metabolic disorders that can predispose you to that, certain lifestyle choices that can predispose you to getting toenail fungus. Nevertheless, what toenail fungus is an infection of fungus into your toenails, and that causes your nails to get thick and yellow and brittle and somewhat painful at times.
All right, and what kind of treatment methods do you have for patients with fungal nails?
Well, there are a lot of treatments for this, and some people choose not to treat it. So that's one treatment, and that causes the fungal infection to get worse and spread. And it can spread to your other toenails, and it can spread to your fingernails. So most people don't choose that. There is a pill you could take. The pill does have side effects, and you do need to get a blood test before you start the pill. And then halfway through taking the pill for 3 months, you have to get another blood test to make sure your liver is okay. So there is a risk to your liver if you take the pill. So that's not usually what most people want to do. There's a laser. There are several lasers that have come out recently that can work. Now this, of course, is not a permanent cure. The lasers are not covered by insurance, and usually the cost is around $1,000. So most people don't want to try this either, but some people do. There's a chance that, of course, the infection could come back and you'd require another treatment. And then there are several topical treatments, and usually the topical treatments you can buy in the store don't work at all. But there is one topical treatment that we've found that works quite well, and that's called Formula 3. And we've used this thousands of times in our institute, and we've had great results with it. And it's a simple little box that comes with a nail polish that goes on your toenails that are infected twice a day. And it's a simple application, just like putting on a clear nail polish. You put it on, and you can put your socks on and go about your day. Simply use it twice a day. And it's inexpensive, it's readily available, there's no side effects, and it's safe. And most people choose this. No matter what method you choose, it takes around 6 months to a year for the toenail to grow out, because the toenail that's yellow and discolored and doesn't look good will never go away. It has to grow a new toenail. And as it does that, to replace it, it takes about 6 months to a year. Now, there are prosthetic nails that can be put on over that, but that precludes you from utilizing the Formula 3. And there is the advantage of the laser, whereas if you pay for the laser, you can get that done, and then you can put a prosthetic nail or paint your nails over the bad-looking nail as it grows out.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Erin Wolf. Right now, we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he is our specialist on foot and ankle conditions. Nice to have you with us, Dr. Michaels.
Thank you, Erin.
We first want to start off with, what are ingrown toenails?
Well, ingrown toenails are simply when the toenail grows into the toe, and it acts as a foreign body and creates an infection. A lot of times children get this, or adults get it after trauma. They're mainly caused by traumatizing the base of the nail, or the matrix, or the root. And wherever you have root, you have toenail growing out from that point. So if you drop something on your toe, it's going to squish the root over to the side of the toe, and your toenail is going to grow down on the side and into the skin. And so your body is going to try to fight off that toenail by creating redness, pus, and infection, and inflammatory response. It's trying to eat the toenail, and it's, your toenail's acting like a foreign body, so you have to get the toenail out. And oftentimes people prescribe antibiotics for this, and that really doesn't work. The best thing is to have a procedure done to remove the ingrown toenail.
All right, and besides that procedure, what else can you do to treat someone who has an ingrown toenail?
Well, the treatments for that, like I said, are antibiotics, and you can do that if there's a really bad infection to begin with. Oftentimes, though, that's not necessarily necessary, and it could be overutilization of antibiotics. The best thing, since the toenail is acting like a foreign body, is to remove that part of the toenail that's growing into the skin and kill the root of the toenail in that section of the toenail. So you want to take out a little sliver of toenail on the side of the toe. But this is a painless procedure because we anesthetize the toe before we do it, okay? And that part hurts a little bit, but after that there's really no pain at all with this because, for example, children that have this done are out playing soccer the next day. So there's very little pain associated with this. Really the only thing is that initial little shot that we have to do so you don't feel anything. After that, it's a matter of just removing the ingrown toenail portion, applying a chemical, or using a laser to kill the root of the toenail that has moved over to that side of the toe that's causing this. If you just remove the ingrown toenail and didn't affect the root of the toenail, then it would just grow back. So you have to solve the problem, and you want to solve it right the first time. And that's what we do. So we do this procedure, and we put a small little chemical on there or use a laser to kill the root, which creates a little bit of a small wound underneath the skin. And therefore, you have to do dressing changes on this daily. We have a kit at the Institute where you just use this kit. It has everything you need, and you do a daily dressing change for about a week, week and a half, and then you're healed. And that takes pretty much care of the ingrown toenail problem for you on that toe, on that side of the toe, for the rest of your life. Now, you can get ingrown toenails on other toes and other sides, but usually that's a permanent fix for that toe on that side of the toe.
All right, thanks so much, Dr. Michaels. And again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com.